Hey guys, wanted to cover a topic today that is especially relevant for anyone looking into getting a puppy or already has a young dog. However, it can affect any age population. It's just that the really young and to a degree the older animals are at a greater risk. So first off, parvovirus. What are these symptoms? Symptoms of this condition include vomiting, not having much interest in food, diarrhea. Sometimes it starts out a little more forms, gets more and more liquid, may or may not have blood in it, and also just really bad lethargy. They're so behind on fluids, they get dehydrated so quickly that they don't want to do very much. And normally puppies can go through short stages where they feel a little more sleepy, but these dogs really don't want to play at all. They just feel bad. So, what do you need to know about this condition? So first off, it is highly contagious. So a young dog especially, as I said, is at high risk. Their immune system hasn't fully developed yet. They haven't been exposed to all that many things. And this can be transmitted so easily. How? It usually is by the fecal oral routes. What I mean by that is poop. Dogs lick it, they sniff it, they get up in it. Dogs love poop. So we need to take serious precautions in taking our young pups out and about in the general population, because a dog may be shedding the virus when they're at the dog park or at a puppy class. So need to be very, very cautious of this. So your dog gets this condition or starts showing signs that may indicate it. What do? Go to your veterinarian. There is a test that they can run on stool sample, on poop, to see if the dog comes up positive. If it does, then we really need to start treatment, which I'll go into next. However, there is a chance with these tests. They're just called a fecal snap test. Parvovirus, it can be not actively shedding at that moment that the test is run, so it may come up as negative, but be a false negative. Your dog truly has parvovirus, you just haven't caught it yet. So if any scenario, a dog, especially a young dog, is having vomiting, not eating, profuse diarrhea, and that lethargic, really they may need to be hospitalized. They may need some pretty aggressive supportive care. That brings me to the next step. So parvovirus is a virus. Many people may just assume my dog is really, really sick. He needs antibiotics. And that may be true, but the long story short, the treatment for parvovirus is supportive care. So what I mean by that is fluids, so hydration. So anytime a young, tiny animal is vomiting and diarrhea and they aren't able to hold much down, they're gonna get behind on their hydration really quickly. Number two, they may benefit from absolutely a anti-nausea and an anti-diarrheal medication, sometimes an appetite stimulant as well. And then third, nutritional support. So sometimes, just like us, you see food, you smell food, completely just can't get it down. They may need supportive care, so different medications or supplements to get them nutrition and help get their GI tract moving. This is, as you would expect, this is a condition that mostly affects the small intestinal tract. So that's why they have these symptoms of upper and lower GI issues, but it affects the rapidly dividing cells in the small intestine. What that means is that the nutrition, the little bit that can still come in, is not absorbed well. And then also that barrier, the gut barrier that prevents all of those microbiomes that are healthy and happy and good for our GI tract, suddenly go places they maybe shouldn't. So that barrier can be an issue. It's no longer a strong, healthy endothelium or lining of our intestines. So these poor puppies may sometimes, for that reason, also need antibiotics. That's something you need to talk with your veterinarian about. Not all do. It's dependent on their clinical signs, their CBC, some blood work, checking a lot of different parameters. But long story short, what is so good about this is, one, most dogs, honestly, it's reported about 90% of puppies that contract this illness will improve and recover if you can afford the really expensive supportive care. And I'm talking ICU level, isolation. These dogs need potentially days, or even I've seen some that have needed to stay in the hospital longer than a week, and that gets expensive. Some can be managed more outpatient, so you bring them into the vet sometimes once a day, they get a little under the skin fluids, some medications to help them hold some things down. And sometimes if they're strong enough, their immune system is still doing okay, they can do okay at home. The next factor, you get them home. your other dogs at home are at risk, even if they've been vaccinated. So you need to talk to your veterinarian about how to decontaminate surfaces. Usually bleach is required for the surfaces that can be bleached. And then also really serious control of poop. After these dogs go home, they still do actively shed some of this virus. And so you need to really be diligent about cleaning up after them, not taking them to public places, and talk to your vet about that timeline. So, parvovirus is scary, but can be treated, and most importantly, is preventable. And prevention with vaccines is so much cheaper and so much kinder for your pup to not have to go through all that distress.